Good evening and welcome to ATV. I'm Suad Asfour, your host. Chiropractors are often the first stop for people seeking preventive care or treatment without using medication or surgeries. My guest today is Dr. Rick Mansour. He is here today to tell us a little bit about chiropractor care and treatment. Welcome to the show, Dr. Rick.
Thank you.
Thank you for coming.
Thank you for having me.
Dr. Rick, can you tell us a little bit more about yourself, first of all?
Sure. I'm married. I have 4 children, and I have 6 grandsons.
Wow.
And so I've been very blessed. I've been working as a chiropractic doctor for 30 years.
Wow.
So
in Gilroy, in the city of Gilroy, same
yes.
location?
Yes, in the same location
Great.
in Gilroy, California.
Uh-huh.
And that's...
So what made you interested to become a chiropractor?
Well, that goes way back. Actually, it started in 1979 when I graduated from the university. I had a friend whose father was a chiropractor. And at that particular time in my life, I was searching, and I was looking for a field that would offer a wellness approach to healthcare that didn't involve drugs. And the reason is because I saw a lot of damage to what illegal drugs and legal drugs did to people. And so I was wanted to find a profession that embraced that philosophy of wellness, and that's what got me interested in it.
Mm-hmm. Okay, so let's start from the very beginning. What are the requirements that you need to become a doctor as a chiropractor?
Well, the requirements are similar to getting into medical school. You have to have at least you have to have a bachelor's degree to begin with.
You have to finish high school?
Finish high school.
Finish high school.
Right, and then 4 years of college, which include the sciences, chemistry and biochemistry and anatomy and physiology. And then it's 3.5 years more of schooling outside of the university. So it's 3.5 more years. So then you're taking the same kind of classes that you would if you went to medical school. The only difference is that the focus is mainly on the neuromusculoskeletal, the bones, the muscles, and the nerves.
Oh, you have to study all that.
But you have to study all that, exactly, right.
Okay, so what does chiropractor treat or diagnose?
Well, I mean, as far as diagnosis is concerned, we have to diagnose disease. So whether you have a back problem, if you came in with a back problem and actually it was let's say something that was like an arterial problem or a tumor or an infection, I would have to be able to differentially diagnose that because, of course, we're legally allowed to diagnose disease. In fact, we have to diagnose disease because I could hurt you if I didn't know what your problem was. So we can do the same types of tests, blood tests, we can do MRIs, we can do x-rays, take histories of our patients. But primarily what we treat is back pain and neuromusculoskeletal problems.
So what are the basic principles of the chiropractor care?
Well, that's a good question. The principle is based on the fact that the body can heal itself. And a good example of that is probably when you were a child, if you ever got a cut. I remember as a young child, there was a topical that you'd put on the cut called mercurochrome. And I remember it burned really badly.
Right.
And they'd put that on you, and then you'd put a Band-Aid on it, and then miraculously I thought, well, the mercurochrome really worked because it healed it. And then maybe, 5 years later, it was bacitracin, which was another antibiotic or cream that you put on a cut, right?
Uh-huh.
And it healed. And then I realized that really it wasn't the mercurochrome or the bacitracin, it was really my body that was healing itself. So, the principles of chiropractic is that the power that made the body is the power that can heal the body as long as there's no interference to the nervous system. And of course, we expand upon that as well.
So we do have a pharmacy basically inside our body that help us to heal.
Exactly.
right?
We do. We have a pharmacy inside our body that helps us to heal. We have an immune system, and everything is controlled by the nervous system, right? So everything your body does, from the heartbeat to, so your stomach digesting its food, to everything is all based on the nervous system. And you know that because if you ever cut a nerve to a particular organ, that organ would stop functioning. Okay? So our philosophy is that if you have pressure on the nerve, it's going to can eventually affect whatever's at the end of that nerve, whether it be your heart, your stomach, whatever.
Yeah, but people have this idea like they don't believe of going to a chiropractor unless they have an alignment problem, or like they feel like they're not walking straight, or they have seriousness with their back and they don't want to go to the doctor. But they don't consider the chiropractor as somebody they can go to anytime. What is that philosophy all about?
Well, I kind of blame chiropractic on that, the reason is because people aren't educated on the fact that chiropractors are, doctors that can diagnose disease. Can they treat everything? Absolutely not. If you had something I need to refer you to a medical specialist for, of course I would do that. I've had patients who, I'll give you an example, came in with a headache. And I evaluated her. She was an older woman. She's had these headaches. So during my evaluation, I found out that she had what they call stenosis of the carotid arteries, which means that she had clogging of the arteries. And I picked that up on with a stethoscope. And I immediately sent her out to a surgeon to have that taken care of. A specialist, right. You're right. So, no, I wasn't going to treat that aspect of her problem, and I got her out of there as quickly as I possibly could. So, again, we need to diagnose, but as far as some of the more unknown things that we treat, again, those are the things that some people don't understand, that, oh, well, maybe my stomach hurts because I have a subluxation or a bone out of place in my mid-back, which is affecting the nerves that go to the stomach. And that's why I'm feeling this agitation to my stomach. Or sometimes a rapid heartbeat, or, those types of things. So.
Well, I'm thinking people don't have that much trust in chiropractor because they don't know how to pick one. So what's your suggestion how to find the good chiropractor? Now, we know the insurance company doesn't cover that, and most of them are on their own, to pick their own chiropractor, right?
Well,
so
no, not
how
necessarily.
Do we find a good one?
Yeah. Insurance companies do cover chiropractic. Okay, so you do have Blue Cross, Blue Shield, Medicare. The big ones, Aetna. A lot of them now are HMOs and PPOs and things like that, and they do have chiropractic coverage. But that's dwindling for not just chiropractors; it's dwindling for all the healthcare professionals,
right,
just because of what's going on. But how to pick a good chiropractor? I think you can go to the California Chiropractic Association. We have a large association, and you can ask them, what are some of the how to pick a chiropractor. Primarily, it's just like how you pick your medical doctor, or you pick your dentist, or you pick your, whoever. You have to go by referrals. People tell you, oh, he's great, he's did a good job. And a lot of it's referrals, and then maybe asking them where they went to school, and, that kind of stuff.
Yeah, so what do you say to people who are skeptical about chiropractors?
I tell them that's fine to be a skeptic. I don't blame you being skeptical. Just don't be closed-minded, because a lot of people base their opinions on chiropractic not on experience, but on hearsay. And usually that hearsay is from somebody who's never been to a chiropractor, never experienced chiropractic, and has no knowledge about it. But they just kind of throw the baby out with the bathwater because, they might have heard from somebody that, oh, this, person got hurt. Well, if you went to your medical doctor and you had a bad experience, you wouldn't throw out all medical doctors. You'd go find somebody else. And it's the same thing with chiropractic. You would just, you got to find somebody that works.
Oh, great. So if you were not a chiropractor, what would you do?
Ooh, that's a good question. If I wasn't a chiropractor, what would
you do with your life?
Probably teach yoga.
Oh, yeah.
No, I'm just teasing. I don't know. I love chiropractic. I always wanted to be in the healing arts, but when I was in college, actually, my undergraduate major was philosophy, and I wanted to teach. So probably be some kind of a teacher.
Well, I never been to a chiropractor, even though I know you for a long time and you're always there, but I never had the need for it. So what are people like first visit? Patient come to your office for the first visit. What are they like? Are they nervous? How do they behave? How do you build rapport with them and get them comfortable? How do they act?
Uh, They act all differently. I mean, some of people who've never been to a chiropractor have lots of questions, and they ask me a lot of questions. So I try to keep them calm in that regards. I mean, essentially, it's like, I mean, we take a history, and I learn more about my patients before I touch them or examine them or anything like that. So a lot of it is talking. So the first maybe 15, 30 minutes I talk, and I let them ask me questions. And hopefully I answer them to the best of my ability. And, and of course the biggest question is, does it hurt? Is this going to hurt? And to answer that question, it's hard because some people I've had come into my office, they can't even walk. I mean, people have actually literally had to carry them in because they hurt so bad. And so, we have to deal with that. And again, since we're a drugless profession, that's a tough one because if you're in a lot of pain, I'm not going to be giving you medications. And it's, it's just not our philosophy, but we can do things to help with pain. So we do a lot of, ice, or we do physical therapy like ultrasound, or I have a laser in my office that helps with pain. So we can do other things.
What's the weirdest thing that any of your clients did from first visit?
The weirdest thing that they did, or the weirdest thing that they came in with? Oh, the weirdest thing that they did?
Yeah, either way.
That's a good question. I had a, there's certain stories I can't tell you, but I had a patient that screamed really loud when she got adjusted, and I guess the door was closed and there was somebody waiting outside, so when I opened the door, I remember him saying, "I'm not going in there. I heard her scream." But I said, but she couldn't walk when she came in, and now she's walking. So he came in.
Oh, good. So that was a good example for your work.
Right.
Wow, that's good. So what is the most rewarding gift that people receive from the chiropractor?
Well, the most rewarding is really helping people get well and then helping people stay well. And that's really rewarding. And we see all age groups too. I mean, we see people, I've treated as young as a 1-year-old all the way up into a 95-year-old man. So, I mean, it just depends. And I know a lot of controversy revolves around, well, what do you do with a 1-year-old?
Well, so is there a way to improve people's health without any invasive drugs and surgeries and all this? Is there a way to heal the problem they have forever without having to go to the doctor, just by fixing it with the chiropractor?
Well, and again, that's a good question. And wellness care is something that, we all try to, well, chiropractors in general try to promote. As far as, health is concerned, that rests on the shoulders of the patient in a lot of ways. My job is to educate the patient on things that they can do to keep themselves healthy. Okay. Now, when it comes down to back pain and that kind of stuff, that's what I call sick care. Okay. When you come into me, you're sick, you're hurting, you have pain. My job is to get you out of pain, help the body heal itself naturally and without any side effects. Okay. But as far as wellness care, that's something that I have to educate my patient on, as well as have them follow through with it. And a lot of times I can tell them what they need to know. And there's so much information now. But getting them to do it is a different story.
Do they listen?
Some do, some don't, So, I mean, the obvious things like don't smoke because of lung cancer, right? And bronchitis and all the horrible things that smoking does to your body. But some people will never quit. Don't abuse drugs or alcohol. Some people just don't listen. A lot of things that you can do for yourself, you can prevent probably 90% of all the diseases that are out there. I mean, even cancer. There's wonderful, wonderful natural therapies or things you can do preventatively on a daily basis to keep yourself healthy. Whether people do that or not is up to them.
What about the massage places? I know people lately, like recently, they're going like out of style just to get a massage, thinking that it's gonna feel better. And does that replace the chiropractor? Because they're opening a lot of massage places. So is that taken away from you guys?
It's interesting you say that. I love massage, and I get a massage at least once a week. So no, I'm not opposed to massage. Massage is excellent for muscle pain. I think it's very good, and it helps with blood flow and even lymphatic, flow and that kind of stuff. Chiropractic is totally different. I mean, chiropractors, we are legally licensed healthcare professionals. We have malpractice insurance. We are doctors. We can perform diagnosis. We can perform tests, whether it's MRIs, X-rays, blood tests. We actually, can diagnose problems, okay? So if you have something where you're getting like numbness down your arms or pain and numbness down your legs or you're getting chronic headaches or, things that, massage is not going to fix, then you need to come and see a chiropractor. But as far as massage, I have a massage therapist. She works in the office and she's phenomenal. So sometimes, I just refer to her.
Wow, that's great. So chiropractor is the largest natural healthcare, basically, and I know it goes back in history since 1800 through 1893 when the controversy came, and people were against it for a little while, but then of course it's because it was accepted by major healthcares in the United States, and now it's on a national level with more professionalism. Now, what happened with over the history, over time? What happened with this profession, as much as you know from your experience?
Well, I mean, obviously, it started with in 1890s.
1800
the
through
1800s.
1893.
Right. So the education has improved tremendously since then. I think that it had very humble beginnings. The philosophy was correct, but of course, I mean, if you look back on medical education too, it was very different than it is today, right? Mm-hmm. So the difference, I guess, was the philosophy of the two camps, whether people were in the medical camp or they were in the chiropractic camp. And that's where I think the controversy started. I think the reason the chiropractic gained legitimacy was because it works. People were getting results. And back in the early 1900s, chiropractors were being thrown in jail for practicing medicine without a license, and their patients would go to the jailhouse and bail them out and have them treat them, and then they get thrown back in jail for practicing, and then they would bail them out. And that was really how it all started, because chiropractors were getting results. And so obviously when something works, people, they want it, okay? And especially if they're not getting help anywhere else, okay? And so I guess now with the difference of the education and understanding with MRIs. In fact, when I graduated from chiropractic college, there was no such thing as MRIs. We didn't have MRIs. MRIs actually proved the subluxation exists.
Wow.
Because you could actually see it on an MRI, and you could see where the nerves were being pinched and the discs are being broken and herniated and that kind of stuff. So it's kind of interesting that they knew that back in the 1800s, but they didn't have the tools to prove it.
Okay, so you do use all these X-rays before you treat?
Well, it depends on the history of the patient.
Okay,
Right.
So what do you think will happen to the profession in the next few years? Is it going to get better, or is it going to lose some of momentum?
Wow, that's another good question. I can't predict the future. I think that people are, to use a phrase, sick and tired of being sick and tired. And so they're very suspicious of medications. They recognize that medications have side effects. So it's not that they're not going to the doctors, but they're questioning the medications that they're being given. And they're looking for alternatives to medications and surgeries to get better. So my feeling is that people are looking for natural health care, and they're looking at chiropractic, they're looking at acupuncture, they're looking at naturopathic medicine, and all of it's good. And I think the medical profession, the younger guys are coming around, and they're kind of working with chiropractors now, and I think they are. So the future, again, it just depends on what patients want and what they're being allowed to have. Unfortunately, with the way insurances are now, a lot of the patients aren't being allowed to have natural health care. They're actually being pushed into the medical model because for some reason insurances would rather pay for a $2,000 x-ray or a $100,000 back surgery than a $1,500 chiropractic care where they don't need surgery. And that's unfortunate because people go where the money.
Yeah, it's because people are not fully educated about what the chiropractor can provide them.
Correct.
So what's the most common problem right now we have this season that people complain from, or you get more cases of?
Well, as I told you, chiropractic isn't so much seasonal because back pain is so ubiquitous. It's so common. In fact,
mostly back pain.
Right. The only thing that's more common than back pain is a common cold. So people's backs and necks and bodies can hurt year-round. I guess probably during the summer I see more sports injuries. So because people are out there and they're weekend warriors and they're going out and playing tennis when they haven't played tennis forever, so I'll get like a tennis elbow patient, or somebody might do I don't know, martial arts. In fact, I have a couple of people that are into that martial arts, and they hurt their neck and their backs, and so I see a lot more sports injuries this time of year as opposed to, let's say, during the winter where I don't see that much.
But how do you treat cold?
That's
as a chiropractor.
Right. Typically I don't, because a cold is a virus. And this is how I treat colds. I tell people, what are you eating? What did you eat yesterday? What are your stress levels? There are certain blood tests you can do to find out what your immune system is doing. But if somebody has a cold, it's not, it's actually somewhat good to get sick every once in a while. I know people don't understand that. They kind of go, well, why? I have a fever. Well, actually, a fever is good for you. Why? Because the fever, depending, it helps increase your white blood cell count, which actually helps increase your immune system. So actually too, your body raises its temperature, so it kills the virus or the bacteria that's causing the fever. So it's not a good idea to drop it too low, but of course you need to sleep. And people don't want to be in pain too. So how would I treat a cold? I probably would treat it nutritionally. I would ask them about their food intake, what they're eating, that kind of stuff, what their stress levels are. And then I would tell them to eat foods that are higher in vitamins that help support immune function. And then, of course, we also have herbal medicines too that help.
So what is a good healthy diet for one day for one person over 50?
Over 50. Oh, geez.
Do you think the age has anything to do with
yes.
the back pain and all this?
Yes, absolutely.
When we're young, we don't feel none of that stuff.
Right, exactly. Yeah, that's a good point. Well, okay, let's go back to the diet. So diet, an anti-inflammatory diet is probably the best because inflammation is what ages us, and inflammation is what causes a lot of our problems. So there's a good book called The Anti-Inflammatory Diet by Dr. Sinatra, and he's a cardiologist.
Good to know.
So it's a good book. You can read it. That helps. Again, more vegetables, more fruits. Stay away from sugar. Sugar will lower your immune system, and it's so hard for me because I love chocolate. But sugar will drop your immune system, like one can of sodas drop it 50% for up to 12 hours. You know, so the problem with it again is that when you lower your immune system and then you're exposed to viruses that are around us all the time, that's when you get sick. So it's not just tissue plus viruses that make you sick. It's tissue plus viruses plus a weakened immune system, right?
Okay.
Because your immune system's high.
It's all connected.
It's all connected, right.
Okay, with the last 1 minute, we need your final advice for people how to take care of themselves so they'll be in good health.
Okay, very quickly. First of all, probably get sleep. I mean, sleep is so important. Lots of sleep. But I mean, it's not hours, it's quality sleep. Okay. And people kind of know, well, how do I do that? Well, one of the things is stay off a computer, especially at night, because we understand that computers and cell phones, they actually lower the melatonin levels in your brain. Melatonin has a lot to do with restful sleep. So a lot of people that are on computers late at night, they don't sleep well. And especially people who drink coffee or caffeinated drinks or things like that late at night, they don't sleep well. And if you're waking up tired, you know, that's not good. So get plenty of get good quality sleep. Exercise every day. I exercise 7 days a week, but make sure you exercise at least 5 days a week.
That's
and
good.
Then, you know, again, a good diet.
That's good. Thank you, doctor.
You're
thank
welcome.
you so much. I wish we have more time.
Yes.
But thank you so much for coming.
You're
I
welcome.
really appreciate all your advice, and I hope everybody go buy it.
Thank you.
And it was great having you with us today.
Thank you.
Thank you for watching. See you next time.